As an invisible enemy, SARS-CoV-2, an RNA-based virus, has caused COVID-19, a predominantly respiratory illness, in so many people across the entire globe. Yes, it's true that around 80% of cases will be mild to moderate. But what does that mean exactly? How many of those mild to moderate cases will have lasting, devastating consequences? We don't know yet. This virus is novel, and we don't have the science to back up what are the long-term consequences of contracting this illness. Will there be lasting damage such as reduced lung function? Since you're more likely to contract this virus if you have an underlying condition or if you're immunocompromised, such as if you have a chronic respiratory disease, a cardiovascular disease, or diabetes. But I wonder, and the research doesn't really show this yet, what about other lifestyle factors? What about those who smoke, those who vape? What about those who have poor diets? Or simply even those who have just recently had the flu or just a common cold and their immune systems are suppressed. And as we're now seeing in the literature and the studies that are coming in on COVID-19, younger people are also vulnerable to contracting this virus and developing COVID-19. Younger people, even those without an underlying medical condition. What makes young people at risk for contracting this type of virus if they don't have an underlying medical condition? These are key questions to ask, and key questions to ask yourself if you want to prevent from contracting this or other viruses. And another thing is, how do you know you're truly healthy? Do you know that for a fact? Are you doing everything in your lifestyle possible to help prevent from contracting this virus? Or at least if you do contract it, how do you minimize the damage that it's doing to your body? And how can you get over it quicker? We don't simply have the research at hand to answer all of these questions. But what we do know now are key steps to take in order to actually help prevent from contracting this in the first place. I want to take you through 3 actionable steps you can take in order to help give you the best chance at preventing from contracting this type of virus or any other type of respiratory illness. Here's my 3-step arsenal for prevention. First and foremost, stay at home. It saves lives. We have the research now showing that these steps in mitigation are actually working. People staying at home and social distancing, or what I like to call physical distancing, is one of the best steps you can take to help mitigate the spread of this disease. We are seeing this time and time again. People are still getting together, whether at church or on the beach or even farmers markets. People, please stop. I'm asking you to stop gathering. The best thing you could do to not just help yourself, but other people around you, your neighbors, your loved ones, family, everywhere, is to stay at home at all costs. Nothing is more important than a human life, whether yours or someone else's. So stay at home. If you're sick, you hear this time and time again, self-isolate. Remove yourself from everyone in the household. Have a separate area that you can stay in the house, and don't have any contact with the other members in your family if at all possible. This is self-quarantine. If you know you've been around someone who has had it, or if you've come from an area and traveled from an area that has been affected badly by this, please stay at home. Like we've heard, a minimum of 2 weeks, please stay at home. The very next step is to wash your hands with soap and water for a minimum of 20 seconds. We've heard various different numbers, and the CDC says 20 seconds at minimum to wash your hands. Now we want this to be vigorous, scrubbing and rubbing, getting underneath the nail bed. If you have super long nails, or if you have gel nails or anything like that, You might want to consider using a toothbrush. No, not the one that you use for your mouth, a clean one, but really some kind of a nail brush or a toothbrush that gets right underneath, because you want to do a thorough cleaning. I can't tell you how many people too, when they finish washing their hands, they will, with their clean hands, turn the dirty faucet off with their clean hands. Please use a paper towel to do that. You do not want to use your own hands, your clean hands, to turn the faucet off. That's totally wrong. You're going to reinfect your hand, and that is not what you want. And as nice as it is for celebrities to display their hand washing on the internet for everyone, I'm sorry, but so many of them have done it wrong. Please refer to Dr. Sanjay Gupta or Dr. Oz. They had very great, wonderful examples of how to properly wash your hands without reinfecting your hands or just disinfecting them properly to begin with. Now, if you have no choice but to leave your house for essential needs, now this is essential. This isn't, I have time in my schedule and now I think I'm just going to go run 10 errands. No. Essential means I'm out of a medication and I have to go to the pharmacy because I have no choice. And you can always call ahead, and many of them are very willing to meet you either outside or deliver it to your car or something like that. So it decreases your exposure to others and others' exposure to you. So that's always an option. But if you have to leave the house for work, let's say that you're a healthcare worker, or maybe you're a police officer and you have to go and work, or you have a job at the grocery store. The key to when you come home is to disinfect. Another thing that you could do is when you come home, take off your shoes. You do not want to be carrying in all of that from the outside inside. One of the best tips is to act like you have the virus. So when you come home, pretend you have the virus on you, whether in your hair, on your face, on your hands, on your shoes, on your clothes, whatever it is, or anything that you're carrying into the home, including your cell phone. You want to disinfect thoroughly. You want to disinfect everything from your clothes to your hands. First things first. You wash your hands with soap, right? You disinfect that, then you disinfect all knobs, handles, anything that you touch. Now that's including everything in your car as well, which is your steering wheel or your seatbelt buckle, your handles in your car. Every single thing that you touch, whether inside your home or outside of your home, you should be disinfecting. Now, if you do not have access to soap and water, obviously it's difficult when you are running an errand like going to the pharmacy or the grocery store. The CDC recommends at least a 60% alcohol-based sanitizer. So that would be great to have on hand or in your pocket that you can keep with you at all times. That brings me to my next point, is do not touch your face. That is the worst thing you can do. This virus spreads through mucous membranes. So do not touch your nose, do not touch your eyes, do not rub your eyes. Another key tip here is that let's say you're out and about and all of a sudden your face is itchy. What do? Do you itch with your hands? Answer is absolutely not. Well, a good thing would be is if you had sanitizer, you would first sanitize your hands super quick and your face might be itching, but you sanitize your hands and then you could scratch your face, or what would be even better is you sanitize your hands. And then if you had a little pack of tissues to have at hand, just in case you have an itch or just in case you want to open up a handle with an extra mode of protection, you would have a tissue, you unfold the tissue, and the inside of the tissue is where you would fold it over your hand or your finger, and then you'd itch with that. Now let's say you don't have a tissue. What you could always do is take the inside of your shirt and just itch your face that way. I mean, it is what it is, and it's much safer than using your finger or your hand to touch your face. And so I would like you and challenge you to start creating these habit formation for not touching your face, not just now during this pandemic. But in the fall, if this decides to come back in a second wave, or hey, even every year, the influenza virus, it too spreads with us touching and respiratory droplets and us touching our face. So the best thing we could do is to stop touching our faces with our dirty hands at all times. So what you could do is create habits right now while you're at home. I challenge you to stop touching your face in its entirety. I mean, regardless, if you're on the computer, if you're watching a movie, stop biting your nails, stop touching your face. Some things that could help are, you could try this, wearing mittens at home while you're watching a thriller or movie, or where you would find yourself typically or having a tendency to touch your face. You can try some of these tips and tricks with this. So mittens, gloves. You can also try taping, putting tape on your fingers or your fingernails. You could also wear more makeup. I know a lot of people who wear makeup don't like to touch their face because you're going to ruin the makeup. So wear more makeup for the purpose of not touching your face at all. Another thing that you could do is keep your nails super short. That might make it much harder for biting their nails. And overall, it'll help with better hygiene and better cleanliness, and will diminish or at least minimize the amount of bacteria and viruses that can collect underneath the nail bed. When it comes to packages, remember, the virus can actually live on cardboard for 24 hours and plastic or stainless steel for up to even 3 days. You want to disinfect everything with a 60% based alcohol, or what I like to do is just take a ton of soap and water and really wash everything down as possible. Maybe not the cardboard so much, but the other things that come in through the mail, whether it's food, packages of food, or even when you go grocery shopping, same thing goes. You want to be able to disinfect everything. So try to disinfect everything. If you have a space in the garage, maybe disinfect everything there and then bring it into the house. And if not, then bring it into the house, but make sure you segregate it so much so that you don't start infecting everything else. And then don't forget to disinfect your counter, where you've basically put everything from the outside in. You've disinfected all of that stuff that came in through the packages or groceries, and now disinfect your counter. Disinfect your knobs, your handles to your refrigerator shelves, everything. Anytime you bring anything from outside, inside, disinfect it. In terms of laundry, whether you are a healthcare provider or somebody else that is out doing essential work currently, you want to make sure that you do not bring dirty clothes up into the laundry room and let it just sit there mixed in with everything else. So what I recommend is basically having a basket or box that could sit. I prefer box because cardboard, right? It doesn't live as long on cardboard as it does plastics, for instance, like a plastic basket. Put all the dirty clothes right there, leave it there, let it sit there for a few days, or you could put it in a bag and let it sit there for a few days. And then when you're ready, bring it into the laundry room and definitely wash it separately from everything else. And I would do it on high heat and double up on the detergent. And also maybe consider even washing it twice before you start drying it. So since you're going to be washing things on high heat, perhaps your delicates are maybe not the best things to wear right now. Next, your cell phone, my goodness, it is like a petri dish. Treat it as one. Therefore, really take time in disinfecting it. How I like to do it, sometimes I will use a 60% minimum based sanitizer wipe, but most often I will take a paper towel with soap and water, rub it in, and then I very delicately go around and wipe down my cell phone. And I do that front, back, sides. Now you got to be very careful, of course, depending on the model. I don't know what kind of models are protective against water. So you want to be very careful. And at all times, please have it unplugged from the wall. You don't want to have anything plugged in when you're even using any kind of wet chemical with your phone. So if at minimum, err on the side of safety. Please unplug your phone, wipe it down again, dry it off, make sure it's good to go, and you're good to go. My best piece of advice is that you act like you already have the virus at all times. And chances are you will take all protective and preventive measures seriously. When it comes to wearing masks, remember, masks are recommended in public to protect not so much yourself, but moreover, the other people around you. It's estimated that 25 to 50% of people are asymptomatic. That means there could be so many people walking around with the virus, shedding it to other people who are just more vulnerable, or just other people who are more susceptible of contracting it and actually being symptomatic from it. By wearing a mask, you ensure that you are not going to be shedding the virus to these people. The key here is that even though you might be wearing a mask in public, that doesn't still mean that you can't get it. Again, it could be transmitted through all mucous membranes. Remember, the mask does not protect you entirely. So again, I bring back the point. The best thing you can do is to stay at home at all costs. The concern here is that wearing a mask, you can become complacent, and therefore you think that you're invincible and you can go out in public. And the science is showing that that's not necessarily the case. You can still contract it. You have your eyes exposed, and these masks only do so much. So the best thing that you could do for yourself and for other people, your neighbors, your loved ones, is to stay at home. Physical distance at all costs when you have to leave the house. But remember, thinking that you have the virus, you will start acting more responsibly, and that will in turn not only save your life, but the lives of others around you. So now that we've explored all the different ways the CDC, the NIH, and the World Health Organization have laid out of how to not only decrease the risk of exposure and therefore the spread of the disease. So now let's dive deep into our secondary form of defense against respiratory infectious diseases, as well as what we know so far regarding COVID-19 and what we could do in order to prevent from contracting this type of illness. To date, there is no evidence of any cure, vaccine, or therapies proven to treat the COVID-19 infection. It's important to note that there is absolutely no concrete evidence to show that any dietary aid, herb, or supplement can treat COVID-19. Another really important thing to note here is that some people are going really overboard with herbs or supplements or any other kind of recommendation. They hear that there is a drug or a supplement that could potentially be good and could potentially have some kind of therapeutic benefit in terms of getting rid of COVID-19, protecting you from contracting COVID-19. The problem here is that this could actually pose more danger and more harm to a human body than not even taking in the first place. We just don't have the evidence to date. So be really wary of what you hear. Do your own research and don't just start popping anything and everything, because that can actually do more damage, not only to your cells, but your microbiome and everything else. And overall, right now, the last thing you want to be doing is doing experiments on your body with things that your body has never been introduced to or never taken before. You do not want to just start throwing darts at your health. You want to do it with reason, with purpose, and with evidence. So the question is, what can you do in order to help your immune system and the response of your immune system, especially in a time like this? Now, a side note of great importance to bring up here is that the immune system, when it has a response to a virus, it can be a very beneficial response, or the response can be detrimental, or it could be both. What do I mean by detrimental? Wouldn't your immune system be beneficial at all times? Don't you want a robust immune system that can thwart off any type of invader that comes into your body? I know what you're probably thinking. How can your immune system hurt you? I mean, isn't it designed to help you, to help fight infections and inflammation? I'd like to introduce you to the cytokine storm, a state of hyperinflammation. This is where the immune system is on overdrive, and it produces so many cytokines and chemokines, and it actually starts creating a state whereby it starts attacking even healthy cells and causing damage to your body. This is not a state that you want. This is unfortunately what we're seeing with many COVID-19 patients, especially those who presumably did not have any underlying medical condition. Those who are extremely young and who don't have an underlying medical condition, we're seeing that this type of reaction, which is also referred to as a secondary hemophagocytic lymphohistiocytosis, a state in which the immune system just goes on so much overdrive that it starts destroying everything in its path, including all healthy tissues. And we're finding so many COVID-19 patients who are unfortunately losing the fight to COVID-19 because of this very mechanism, because of this very pathophysiological reaction. The question comes down to, should we boost the immune system, or rather, should we optimize the immune system? Number one, timing is everything. But number two, it depends on the current state of your immune system. So at baseline, do you have underlying medical conditions? Do you not? What's your lifestyle like? These are all factors that you need to keep in mind as to perhaps the steps you should take and how to personalize this approach for yourself. Again, I'm going to stress that we do not have the evidence to tell us one way or another in terms of COVID-19. But we do have the evidence when it comes to other types of infections like SARS or MERS. So what we're finding in the research is that when it comes to COVID-19 or other types of respiratory viral infections, is that perhaps at the very beginning, before you contract it, so to prevent from contracting, a robust immune system is the way to go. But if you've already been diagnosed with or have symptoms of this type of disease of COVID-19, you may want to tone it down in terms of your immune system and just have it optimized. In the medical literature, we're finding that cytokine storms or secondary hemophagocytic lymphohistiocytosis can be exacerbated or brought on by certain things like vitamin D3, echinacea, elderberry, and also isolated polysaccharides of mushroom extracts. These, therefore, are things that you may want to consider avoiding at all costs if you test positive for COVID-19 or have symptoms of COVID-19 infection. However, if you do not test positive for COVID-19 and you do not have symptoms of COVID-19 and you simply want to prevent, then there could be a role for elderberry, and we've seen for vitamin D3. But again, during the actual infection phase of COVID-19, those 4 things I mentioned before should be taken with great caution. The only time that it would be seemingly safe to ingest elderberry or vitamin D3 is in the preventive stage only. That would be if you do not have any symptoms of COVID-19 and or you do not test positive for COVID-19. If you just want to boost up your immune system beforehand. But again, during the course of the infection, you do not want to rev up your immune system because of this potential cytokine storm effect. Again, vitamin D3 would be important only in the preventive stage of contracting COVID-19, since it does have antiviral properties and has been shown in studies to help fight off various other types of infections and inflammation in general. So in some studies, vitamin D3 has been shown to significantly reduce acute respiratory illnesses by decreasing what we call the NLRP3 inflammasome, so a part of the inflammatory reaction. But it's important to note that it may and has shown in studies to increase IL-1B, which is a part of the inflammatory response. So again, you should definitely consider discontinuing vitamin D3 supplementation if you test positive for COVID-19 or if you have symptoms of COVID-19. So what else decreases this NLRP3 inflammasome? Vitamin C. Vitamin C, or known as ascorbic acid, is a water-soluble vitamin that can be found in so many different fruits and vegetables, such as guava and papaya, and citrus fruits, oranges and lemons, or superfoods like sea buckthorn, or herbs such as rose hips, acerola cherries, and other fruits and vegetables like that. Not only has it shown to decrease the NLRP3 inflammasome, so potentially decreasing that cytokine storm, it has also been shown to decrease the frequency, duration, and severity of the common cold, as well as decrease the incidence of pneumonia. So as an antiviral, this might show and has shown some evidence in research for other types of infections. So we're seeing that it could potentially play a role and is currently being studied. IV doses of vitamin C are being studied for the potential treatment of COVID-19. Again, we do not have any evidence to show that this can treat or can help with COVID-19. However, there is a lot of evidence in the medical literature to show that vitamin C can indeed enhance the immune system and has been shown to decrease the NLRP3 inflammasome, so decrease the activation of that. This is what we found so far that the coronavirus, COVID-19, actually induces. This NLRP3 inflammasome is part of the inflammatory cascade, which I discussed as part of the cytokine storm. The cytokine storm, which releases this cascade of inflammatory mediators such as interleukin 6 and interleukin 1B and interleukin 1-8, as well as tumor necrosis factor alpha and NF-kappa B. And of course, this is what we're talking about when we say that the body goes into hyperinflammation and overactive drive of the immune system, which unfortunately becomes more of a detriment than a benefit, especially in terms of fighting this type of infection. So, if we can decrease the NLRP3 inflammasome, theoretically would seem that it would in turn benefit the human body to help fight off this infection by decreasing the potential effect of the cytokine storm, by down-regulating these cytokines and therefore being able to control the infection at the rate it needs to in order to be able to handle the inflammation without going into overdrive. In terms of vitamin C, how much you should supplement, different studies and different research shows that even 500 milligrams a day is beneficial. Again, if you don't want to use a supplement at all, you might want to consider just using fruits and vegetables that have those high sources of this water-soluble vitamin. In terms of vitamin C, there has never been an overdose of vitamin C recorded. Really, it is not found in the medical literature, so you could be safe taking 500 milligrams to 2,000 milligrams of vitamin C a day, but really get it from fruits and vegetables if you can, bell peppers, and from citrus fruits. If you want to go into your superfoods such as sea buckthorn, you could also do that. So next, I'd like to draw your attention to zinc. Zinc is an essential mineral that is involved in so many different biochemical reactions and enzymatic reactions in the human body. Zinc is essential in reducing our inflammation, oxidative stress, and our rates of infection. Zinc also has a tremendous role in wound healing as well as DNA synthesis. So many people are deficient. In fact, it's estimated that 20 to 25% of the population is deficient in zinc. So why would someone be deficient in zinc? One of two reasons. Either you're lacking it in your diet or you're not absorbing it properly. I'd like to just stress here that sometimes taking a supplement could actually be more dangerous. I'm seeing time and time again, people are overdosing on supplements, especially now they're overdoing it. And when it comes to zinc, zinc can actually bind copper, and therefore you might not be getting enough copper in your diet. And copper is responsible in other biochemical reaction. So you gotta really tread lightly, be careful, read your labels, see what you're even taking, and talk to your doctor at all times before even considering ingesting anything at all. And I'm stressing this very much so because people are just dosing up on all of these different supplements, herbs, and therapeutic aids, and they hear something on the media and this misinformation, and they just start taking it, and it's actually causing them more harm than good. I'd like to emphasize and stress that you should talk to your primary care provider and be very wary of just taking anything. The safest thing you could do is get your supplements from your food or supplement with your food. So in this case, when it comes to zinc, you can get zinc from beans like lentils and chickpeas, nuts such as cashews, and seeds such as hemp seeds, pumpkin seeds, sesame seeds, or even whole grains. So why is this important? Why is zinc important? In the literature, it has been shown that zinc has had the ability in cell culture to inhibit RNA-dependent RNA polymerase, otherwise known as replicase, in terms of SARS, the first type of SARS coronavirus that we had in 2003. They found that if zinc can actually make its way intracellularly, so within the cell itself, it can attack the replication phase of the SARS virus. Theoretically, zinc may, we don't know, but may play a role in this type of coronavirus. So it's thought that if we can create some kind of a channel, so a zinc ionophore, zinc can actually travel into the cell much easier and attack the replicase or the replication stage of the RNA virus. So researchers have found that both quercetin, a bioflavonoid found in plants, as well as EGCG, which is found in green tea, can actually act as a zinc ionophore, which brings me to my next point. Quercetin. Quercetin is a bioflavonoid, a super antioxidant, if you will. Flavonoids are found in the plant kingdom. There are so many and have been found in research to have tremendous benefits in terms of antiviral benefits, in terms of DNA repair. And quercetin, found in watercress, onions, cilantro, or asparagus. This bioflavonoid can actually help to decrease the NLRP3 inflammasome that I discussed, which could help mitigate that cytokine storm. And in addition, it, like I mentioned before, could potentially act as a zinc ionophore that would aid in transporting zinc intracellularly. In the end, this could optimize the role of zinc in terms of the destruction or inhibition of replicase or the replication stage of a virus such as COVID-19. Now, we don't know for sure if this could have that effect, But theoretically, since it has that type of effect in cell culture, maybe this is something that you can consider. And again, you don't have to go for the supplement, just like you don't have to supplement with zinc. So what are other flavonoids that have been shown in research that have helped with other types of viruses or respiratory infections, or in terms of inflammation and reducing the whole body, total body systemic inflammation? Curcumin from turmeric, apigenin found in chamomile or parsley, or even myricetin in tomatoes. So these bioflavonoids, just like quercetin, have been found to reduce that inflammasome, that NLRP3. And therefore, all of these bioflavonoids can actually help to decrease and suppress that inflammatory cascade. So I mentioned before EGCG, which is found in green tea, the epigallocatechin gallate, as a zinc ionoform, not only inhibit viral entry, but also attachment and membrane fusion. And this in research has been found for not just RNA, but also DNA viruses as well. So on the whole, we find that EGCG has tremendous antiviral properties. In terms of curcumin, it also has an inhibitory effect on IL-1 and IL-6, as well as tumor necrosis factor, alpha. Next, I'd like to bring your attention to nitric oxide, a chemical that allows your blood vessels to vasodilate. It has also been found in research to inhibit the fusion of the S protein or the spike protein on a coronavirus with its ACE2 receptor. And ACE2 receptors are found in the lungs, in the heart, the kidneys, as well as the GI tract. Research is pointing to the potential of nitric oxide's effect of potentially reducing the production of viral RNA, which brings me to ACE2 receptors. It has been thought that the immunomodulating effects of ACE2 receptors, so the receptors that actually help you in terms of modulating your immune system to help you fight certain infections and decrease inflammation, that the coronavirus binds to these ACE2 receptors and actually is one of the potential reasons for this cytokine storm. The immune system initially goes into overdrive and causes this hyperinflammation, super inflammatory state, releasing this cascade of cytokines and chemokines going in and destroying not only the virus, but also your healthy tissues. And in turn, this can lead to edema and fluid filling in the lungs and making you feel like you're drowning. It could also lead to a decrease in blood pressure, and in turn can lead to a decrease in perfusion of blood and oxygen to your organs. And in the end, it can lead to multi-organ failure. Again, when it comes to SARS-CoV-2, we don't yet know the mechanism that is at play here. However, based on what we're seeing in research from other types of viruses, coronaviruses, and other types of infectious diseases, this could be a very important mechanism to consider in terms of therapeutic approaches or how to even understand the pathophysiology of such an infectious disease. Other antiviral aids, supplements, herbs, or plants that maybe you could consider ingesting are medicinal mushrooms, such as reishi or reishi, how you pronounce it, or turkey tail has antiviral properties. Astragalus is another one, as well as garlic. These are considered likely safe herbs / supplements / plants to eat. Again, when it comes to medicinal mushrooms, you want to either eat them whole or in powder form with the mycelium blended up. Other plants that you may want to consider drinking in tea form are adaptogens such as schisandra or even ashwagandha. They're considered these adaptogens that are considered important in helping to counteract the effects of stress on the human body. Now, again, since these stimulate the immune system, I haven't found any research to show whether or not it's safe in terms of drinking as during the COVID-19 infection. So if you're positive or show symptoms for it. But as a preventive mechanism beforehand, if you want to drink it from time to time, that may be something that you want to consider. I want to really stress that before ingesting any kind of supplement, herb, therapeutic aid, even a plant you've never ate before, you really need to, first of all, talk to your primary care provider to see if it's safe for you based on your age, your sex. If you have any underlying medical condition, if you are taking any kind of other supplement or drug, any kind of medication for anything, there could be a drug or drug herb interaction. And so you may want to consider discussing this with your primary care provider before you start ingesting it. You need to know if it's safe for you, not just in general if it's safe, but if it's safe for you. So these are the questions that you need to ask your doctor. And luckily, we have telehealth, so you can contact your primary care provider and have this discussion with them before you start ingesting anything at all. So now for the tertiary preventive approach, lifestyle modification. That's right, using lifestyle as medicine, you need to learn how you can optimize your lifestyle in order to help you not only enhance or optimize your immune system, but prevent from actually contracting this illness and giving you the best defense possible at fighting any other kind of infectious illness. And quite frankly, it will most certainly help you with chronic disease management as well. So here we go. How to optimize your lifestyle to optimize your health. So on the whole, we are finding patterns that with COVID-19, people who have chronic respiratory diseases, cardiovascular diseases, diabetes, those who are overweight or have underlying conditions, chronic conditions, even autoimmune diseases and asthma, things like that, we are finding that this group of individuals are more susceptible to contracting this infectious disease. So one of the best things that you can do to decrease your risk of contracting this type of illness is to decrease your level of inflammation. And in turn, you will actually help to decrease and manage chronic diseases. So here we go. Number one is sleep. One of the most important things that you could do right now in your home is to create the best sleep hygiene and the best sleep regime that you've ever had before. Sleeping for 7 to 8 hours a night, uninterrupted sleep, is imperative to decreasing the burden of inflammation. It has been shown to reduce that NLRP3 inflammasome. Not only that, sleep actually increases melatonin. Melatonin is considered an endogenous antioxidant, a hormone that reduces oxidative lung injury in times of viral infections. Sleep is one of the best things that you can do to help you to fight off this infection. Next, stress. So your mind, optimizing your mental well-being is crucial in this fight or preventive step against COVID-19, other infections, or even chronic diseases. When you're stressed, your immune system is revved up. Your cortisol is elevated. You are in a fight or flight type of response. This basically makes it extremely difficult for your immune system to function at its best, to function optimally, if you will. And therefore, it will make it very difficult for you to be able to fight off any type of infectious agent that comes your way. So ways that you can reduce your body's stress are things like meditation, mindfulness, breathing techniques, yoga, dancing, tai chi. You can do artwork or self-care. Treat yourself to a bath or just a time out. It's important, especially now, to take a time out. Remove yourself from even social media, the news, and talking about this all day long with everybody, this being the pandemic. It not only weighs on you mentally, but physiologically. This will surely suppress your immune system, and that's the last thing you want right now. The next thing you could do in terms of lifestyle modification is to exercise. Now, you don't want to overdo it because, again, overdoing exercise, putting too much inflammation into your body is not a good thing. But 30 minutes of vigorous exercise a day would be great. You could do a HIIT workout, you can dance. Again, you could do Tai Chi or yoga. There are so many free resources out on the internet, so have fun and just move. Other lifestyle modifications you may want to consider is, in general, eating more plants, so more fruits and vegetables with, again, those bioflavonoids, and taking care of your microbiome and all the trillions of gut microbes that you have. They thrive on fiber and prebiotics, which you can also get from plants. They are actually responsible for a big portion of your immune system. In fact, 70% of your immune system is found in the gut. And if they help regulate it, therefore you should help them in turn by giving them the food they require and they need in order to thrive. These are things that you may want to consider incorporating into your lifestyle. And eating less processed foods, decreasing your amount of sugar that you ingest every day, not eating chemical-laden foods. Again, eating more plants will ensure that you get more of those flavonoids in, which reduces that NLRP3 inflammasome, that cytokine storm, that cascade of these inflammatory mediators coming in. So load up on your veg. If you can't get fresh vegetables, you can most likely get them from, the freezer section of the grocery store. So load up on those. And when it comes to water, try drinking filtered water. The last thing you want to do is be ingesting chemicals from the water, which can also suppress your immune system in the end. One of the most important aspects of lifestyle modification that you should consider is actually boosting up your social support. Social distancing should not equal a reduction in social support. Social distancing should just be physical distancing. We are living in one of the most amazing times where we have, from one click of a button, access to so many people all over the world. We are in a global community, and therefore we are just one click away from connection and community. And I encourage everyone to reach out and have that right now, because that is what everybody needs. So to boost your immune system, one of the best prescriptions is to optimize your level of social support. So there you have it, your 3-step prevention arsenal. I hope that there's some things in here that you can pick up and modify in your lifestyle to help optimize your immune system and give you the best chance at trying to prevent from contracting this type of virus, or trying to keep your immune system as strong as possible to help decrease your overall burden of inflammation. Remember, simply because we currently do not have a vaccine, a therapy, a supplement, or an herb that has been shown to actually fight COVID-19, there are things that you can do to optimize your immune system. I encourage you to talk to your primary care provider and to explore some of these lifestyle modifications that I discussed in points 2 and 3, and see if any of these are right for you based on your underlying medical condition, if you have one, your age, your sex, or anything else that you may have unique to you and your story. If at minimum, simply adhere to the advice of the CDC, the NIH, and the World Health Organization on how to decrease your exposure and risk of contracting COVID-19, as well as maybe considering modifying your lifestyle. I want to leave off with a little piece of hope that even though currently there is no evidence of a vaccine, therapy, any kind of drug, any kind of herbal or supplement or aid that has been proven to fight SARS-CoV-2 or the COVID-19 infection, that there are things that you can do to optimize your immune system. Follow the CDC, the NIH, and the World Health Organization to prevent from contracting the virus, but then also make lifestyle modifications to help really create an immune system that will work in an optimal way to help fight any kind of infection or inflammation that you may be faced with. I really encourage you to do your own research. I encourage you to talk to your primary care provider. I also encourage you to stop listening to the plethora of misinformation on the internet with various different myths. Please cross-reference everything with the CDC, the NIH, and the World Health Organization, because that's where all the evidence is stemming from, as well as doctors and researchers in the leading fields who are bringing all the research that they're finding and evidence that they're finding to the surface. I would really like people to stop watching and listening to these myths and trying therapies that are actually causing far, far more harm than good. I really want us to come together as a community, to lean on each other, support one another, and really find a space where perhaps something as tragic as this that we're all facing, perhaps there's something good. You know, it's creating a community that we've never seen in the world, and that is something so beautiful. Maybe this is an opportunity for us to really unite globally and to have something positive come out of something so negative. Thank you so much for watching this video. I hope you enjoyed it. And if you did, please give it a thumbs up. Also, I'd love for you to just share a comment down below and let me know too what other videos you would like to see from me regarding prevention, using lifestyle as medicine, or anything else regarding medicine. Thanks so much, and stay safe, stay well, and I'll talk to you soon.